How did you come to hear about Steve, and how did you come to see him?
I live in the area, so I've driven by numerous times, and a friend of mine is next door at the Foot Place. One day I called and I said, my back is really messed up. He says, you gotta see my guy. So his friend next door, the gentleman, the business owner next door, actually referred me.
And you came and saw him like within a day or two, or
yes,
easy to get an appointment?
Yes, very easy to get.
Okay. And how did he help you? What did he do?
You know, that's a really good question. I think he waved a magic wand. No, actually, I came in, I had pulled my back and could hardly walk. Getting in and out of my vehicle was difficult. Just that turning motion, I have an SUV, so it's kind of hard to climb up in. And an hour and a half later, I could move. You know, with any injury, there's a healing time, but my muscles, everything was so tight and tense, I just couldn't move without pain.
And so after the appointment, you were pain-free pretty much?
Mobility was definitely there. He used a variety of techniques, from massage to, there was some pressure, there was some, maybe some liniments that he applied, a little bit of heat and what have you. Just, it was a combination of things that I've not ever experienced. I've gone to massage therapists, I've gone to a chiropractor. Can't say that I've had the same results ever.
Okay, were you prescribed herbs at all, or it was?
He did. He actually did give. The first time he gave me some type of healing herbs that he recommended. That they weren't bad. I didn't have any adverse side effects or anything. I felt a lot better. The second time. Because actually, I've entered several different things over the last few weeks. The second time he gave me a bruise mending herb.
And what was that injury?
That was, I had a car trip and drove home with my foot up in the seat and put too much pressure on my hip. And basically what he had found is that I maybe bent or irritated the cartilage, the sacroiliac, the bottom of your hips where everything connects in here. Just put too much pressure on it. And really, I thought it was my lower back, but then once he started working on me, realized it was really my hip and right in the joint where all the pain was. So very similar techniques, just a different area, a little bit different methodology, the way he applied everything and what have you. Mobility, I mean, I could actually get in and out of my car. Previously, I couldn't, and I actually thought I would need somebody to go home with me to help me get in and out of the vehicle.
Right, and so it was immediate relief.
Yes, ma'am.
And again, though it took several days, as usual, the healing process, right?
Right. Well, it's like anything. You get a bruise, it doesn't go away that day. It takes a couple days. And then from that injury, once that had resolved, you compensate, so other parts. So then I had some back and neck that had kind of progressed up that same side of my body, and again came in and same, and it was one of those I couldn't even turn. I couldn't even turn to look. I had a horrible crick in my neck and my whole upper body, maybe even some residual from an injury years ago in college. But he was able to get me in pretty much same day, if not the next day. And experienced immediate relief. Really?
Well, good.
So.
Good. Okay. And so you knew about him from the guy next door, and you lived in the area, you've seen it, the place.
Yes.
Okay. But your experience in general, would you say that it was definitely, he saw you, he didn't make you wait in the waiting room for too long.
Right.
And in general, you felt comfortable, and he was professional?
Yes, absolutely. Okay. My appointment time was pretty much right on. If I was a minute or two late, that would have been why I would have come in late. He was very on time, very professional. He very readily was able to determine the area of pain. A lot of time pain radiates, and so you think it's over here when actually it starts over here. It was very easy for him to identify that. It was very professional in the conversation as far as what needed to occur, how he addressed the pain, how he dealt with it. Overall, it was a great experience.
Good. You would recommend him?
Absolutely.
Okay.
Absolutely.
Good. Would you say, compared to going to a regular MD doctor, what would be the major difference besides the methodology? Would you say, is there anything? you could pinpoint?
I think it's not as clinical and sterile. It's more relaxed. Not that it certainly is very clean and orderly, but it's a more relaxed atmosphere. I felt more comfortable receiving treatment. Between my own health issues and my kiddos, I've been to a lot of different doctors, and you get used to, well, here, pop a pill, take this pain medicine, do this, do that, or have a steroid shot, or let's do X-rays. So initially I was a little skeptical, to be honest. I've known other people who've kind of done this. It's been around for how many thousands of years? There has to be something right if they're still doing it this way. Right. So I thought, okay, I'd give it a try. And I'm no longer a skeptic. I would continue to come back for these types of issues.
Okay, good. And would you say that he spent a lot of time with you as far as really listening to you? Would you say that he was more so than, I'm not saying all doctors don't listen, but a lot of them, in my experience, don't really hear you out all the way. They think they know already. But do you think that he, was an improvement over that?
I think he was a very active listener. He very actively, heard and allowed me to be as descriptive as I wanted to and explain, and definitely ask questions. Well, what were you doing before? What led up to the event? And really probed, but then allowed me to do all the talking. And once he got enough of a word picture of what I was experiencing and where it was, then he examined and started feeling pressure points and what have you, and really nailing down the problem.
And he explained things to you?
He did, and that's very important to me because I want to understand how my body works, and I want to continue to improve and get better, and certainly don't want to repeat the pain. So he pulled out this great diagram and explained to me and showed me, especially on my hip, just how the pieces fit together and where he pinpointed the pain and the perceived damage.
Okay, good. Okay, and you said that you'd been to a chiropractor before.
Yes.
For your back pain?
Yes.
And you did not experience the relief like you did with Steven's procedures?
No.
Okay.
It was very different. It was a college volleyball practice episode, and I overextended and gotten some things out of place a little bit. And unfortunately, a student trainer worked on me, probably enhancing the error. So when I came home for spring break, my folks sent me to a chiropractor, did all the X-rays and all that stuff, and it was weeks before I could play again. Whereas with this, within a week, at least the initial back pain was gone. The hip was probably a little bit longer because it was actually more of a bruise, is how he described it. And then my shoulder and neck pain a day or two. I mean, it was very immediate. Whereas the other, when I was younger too, over 10 years younger, it didn't go away as quickly.
Right. Okay. Very good.